Most parents think physical therapy is just a few stretches after injury. Wrong! You're paying for prevention so your kid avoids sitting out. You're paying for performance so they play at their peak. You're paying for a peace of mind so you stop worrying every game. Stick with me. By the end, I'll give you the one rule that keeps most youth pitchers off the bench. And I'll give you a free checklist to use this week. I'm Dr. Cam, and I help young athletes move better, throw better, and feel safe when they play. I'm not a parent, but I worked with so many parents, and I know that fear in their gut when a kid grabs a shoulder or an elbow during a practice or a game. So this video is simple. I'll show you what you're really buying with sports PT. I'll show you proof, and then I'll share my 12-week online system for young pitchers. And yes, a small free gift at the end. So let me start with a quick story. A 13-year-old, we'll call him Jake. He loved baseball, and he hurt his knee. Not a big tear, but big fear. So what do you know? He stopped sprinting. And he stopped smiling because he wasn't playing. His parents heard 5 different tips, and what do you know? None of them matched. Does that sound familiar to you? We gave Jake a clear plan, the right moves in the right order. Week by week, his movements and drills got sharper, more efficient. His smile began to come back because he can see he was going to get back to sport. This is the power of a smart sports PT. I've went through residencies and fellowships to understand this, and this was really key. So to explain what you're really paying for with the sports PT is number 1, you're paying for expert eyes and not just random exercises, because anyone can Google a stretch, anyone can buy a program. You're buying trained eyes that spot small movement hitches before they become big injuries. I can easily watch a throwing video right now and give you cues in literally seconds. Number 2, prevention. It's not just rehab. You would not wait for the engine light to fix your car. We build the base now, so your athlete misses less later. Number 3, faster, safer comebacks. Rest alone is not a plan. Rest plus the right load is. Bat sooner, so they stay back in the game longer. Number 4, confidence. Pain hates kids. Have you ever seen a kid in pain? It's rough to watch. It's rough to deal with. A clear plan helps build them up though. Confident kids play free, and guess what? Free kids play better. Number 5, my favorite, the personal plan. A pitcher is not a sprinter. A pitcher is not a hitter, even though they're somewhat alike. A 10-year-old is not a 16-year-old. I match the plan to your kid. A sports PT should as well as their sport and their season. Number 6, we're promoting long-term athletic growth, mobility, stability, strength, power, and skill. In that order. We don't start on skill if you're stiff. Like, come on. We want to stack it right, bodies hold up, seasons stack up so they can play a long time. Number 7, we got whole child health. Sleep, simple warm-ups, simple cool-downs, hydration, all the conversations about all of this because we want easy things done and we want big wins. Kids will actually do them if you talk to them about it. Number 8, your peace of mind. We don't want to guess. No more 5 voices at once telling you should do this, you should do that, you should do this, you should do that. They never even align. Why don't you just get one guide and one clear plan? All right, so we're gonna bust out some myths here. So myth number 1, PT is only for big injuries. The truth, little pains become big problems when we ignore them. Early care stops that slide toward a big problem. Myth number 2, you only need a PT after surgery. That's an old school thought. Truth, the best PT happens before we ever need a surgeon. Because we fix patterns, we protect the tissue, and we unlock elite performance. Myth number 3, rest solves everything. Truth, MDDO is prescribing rest because rest calms pain. It does not fix the cause though. The sports PT should fix the why if it's a movement pain issue. Myth number 4, a coach or a YouTube can replace a physical therapist. Coaches coach, trainers train, both matter. A sports PT blends medicine, movement, and safe progress. Together, the team wins. Myth number 5 is PT is painful or boring. Good PT feels like smart training. Games, challenges, small wins that add up. All right, got you with some real people and some real proof. Antonio said, Dr. Cam is the best. I had a torn labrum. His program got me back on the field, and he knows what baseball shoulders need. Profile named All-Star 4 said, can't recommend him enough. My elbow and shoulder pain are gone, and I'm throwing pain free. Caden said, I had shoulder pain that kept coming back. Cam's plan fixed it, and I'm back to throwing without pain. Angela, a baseball mom, said, our son had back and neck issues. A year later, he's stronger, healthier, and more confident. Raina, an online mom, said, "My son had Little League elbow. He recovered, got stronger, and learned good mechanics. My son looks forward to the sessions." Jerry said, "My pitching mechanics and performance improved. I throw without pain now." And yes, this is about young athletes, but just to show proof that I worked with older, I have a comment on my Google reviews about Zach, who said, "Full ACL and meniscus tear at age 43, and I'm back to basketball, custom plan, real results." Kim said her son had classic Little League elbow. He was off the field, and now he's back, and both my boys are throwing better. Alicia said her son had Little League shoulder. My son is back to baseball, pain-free, and enjoys sessions with Dr. Cam. One of the athletes I see often, he said, "I text Dr. Cam, I got a clear plan fast, and my elbow has never felt better." These are normal families. These are normal kids. And the system works. So here are 3 signs you shouldn't ignore. Sign number 1, pain that changes how they move. When they want to limp, they dart, or they avoid going into layback because the arm hurts. Sign number 2 is pain that lasts more than a week with easy play or easy catch. Sign number 3 is pain that wakes them up or hurts at the start of every practice. If you see these, don't wait. Early help saves seasons. So I got you with the do anywhere routine. I call this the 5-minute land, load, and launch. This is your quick win for the week, and this is mainly for young pitchers. So if you want to land, you want to go through your throwing motion and land soft and don't fall over after you throw. You hold your landing. So you stick each landing like a statue, as if somebody was taking a still shot. We want to load. So you load into your back hip, but you got to train to load. Most kids don't even squat or split squat. So we got 10 squats, knees over toes, 10 split squats each side, 10 single leg balance, RDL, reaches, slow and steady. And then we move into the launch. 5 lateral bounds each side, or skater jumps, 5 vertical jumps, 5 short shuffles or sprint. I like to perform a 5-10-5 where we go 5 yards, 10 yards, 5 yards. Remember, quality first, always. This is not a high intensity circuit that we're just trying to push through. If you don't have a strength conditioning professional working with you or a sports PT, start with this 3 days per week. It's simple and foundational. So here's how I help youth pitchers ages 8 to 14. It's called the Healthy Performance System for Young Pitchers. It helps injured youth pitchers return to the mound pain-free, stronger, and more confident in just 12 weeks. So who's it for? It's for people experiencing elbow or shoulder pain, or you're cleared by physical therapy but you're still scared to throw hard, or your mechanics feel off and velocity is down, or coaches not sure how to progress your son after the injury, or parents are stuck in the loop of mixed advice. So what do I deliver is I help eliminate pain, I help rebuild mechanics, I help restore confidence, and I help improve velocity. And last but not least, I help prevent future injury. So what's included with this is if you buy the one-on-one session, you get one-on-one movement and throwing analysis. A custom plan is updated every week, every 2 weeks, or every 3 weeks, depending on how we want this relationship to go. Weekly feedback on your throwing video uploads. You get coaching calls each week, direct access to me for updates and questions, and you always get a performance progress guarantee, full refund if there's no measurable progress. Again, real results. I want to bring you some other results because these are some that stick in my head every time I talk to parents. I have an athlete CT, he had elbow pain in 72 miles an hour, and then he went pain-free, topping 87 miles an hour. Braden, an athlete, threw pain-free for the first time after 2 failed rehabs, and we worked all online. Tyler worked all online, fits early mechanics, built power, and before an injury ever even happened. I keep it small on purpose, so I do have some limited spots each month, so I only take a few athletes per month, so I give you full attention. I promised you one rule that keeps most youth pitchers off the bench, and here it is. If pain changes how they move, we stop the throw, fits the pattern, then progress the load. Not next week, now. We protect the athlete first. Then we build them back up step by step. Say it with me. Stop, fits, progress. That rule saves seasons. I know it's simple. So not all athletes move like elite athletes. So here is a weekly 2-minute screen every Sunday night you can perform. We want to do squats, 10 reps, RDL reaches, single leg balance, 5 each side. Go through your pitching mechanics and stick your landing 5 times. And if anything looks off or hurts, even in your house, you gotta flag it and text me, because those simple tasks should not hurt. Tiny movement tweaks now beat big breaks later. If you want the help tailored to your pitcher, here's your next step. Click the link below to book your free video consultation. We'll review your athlete's throwing mechanics together, and I'll show you exactly how we can help in 12 weeks. You will talk to me, and the program will be delivered by me. You will also find your free youth sports starter checklist in the description that I mentioned earlier. It has the weekly screen, the land load and launch routine, and a simple plan guide for parents. If you're not ready yet, that's okay. Just hit the subscribe so you don't miss the next video. And please share this with another sports parent who needs a plan. Most parents think PT is just stretches, but now you know better. You're investing in safety, in growth, and happiness. Just remember, I'm Dr. Cam, and I got you.